FUE is a method we use for hair transplants. In the FUE technique specifically, we are carefully harvesting the hair follicles from the back of the head one by one. This stands for Follicular Unit Extraction, as it is described in English, and its basic logic refers to the collection of hair follicles from the nape area one by one. We view this as a significant upgrade, specifically 1 or 2 levels above the standard FUE technique. We specifically use the FUE Gold Technique, a more advanced version. The FUE Gold Technique is a slightly more refined version of the FUE method. The logic remains the same. However, in the case of FUE Gold specifically, we utilize gold-plated instruments or materials that are directly made of gold. These specific gold-based materials are materials accepted by the body, so especially for hair follicles, because the risk of causing damage to the hair follicles during the extraction, placement or transfer process is minimal. Being near zero, it boosts success rates. So the FUE Gold method, it has a higher success rate than FUE. Also in FUE Gold, we use punch biopsy needles 0.5 to 0.7 millimeters wide. The biggest benefit of using such fine needles for us and the patient, firstly, is that there will definitely be no issues with scarring for our patient. Since we collect hair follicles from the nape area with very fine needles, they will not have problems with scarring. Another advantage is that by using small punches and needles, we are able to harvest a greater number of hair follicles. This means we can cover more area successfully. It also helps make the transplant look natural. Because to look natural in hair transplantation, you should avoid multifollicle grafts. What do we mean by multifollicle grafts? A single hair graft should not contain 20 to 30 individual hair strands or follicles. If we use a small diameter for the punch biopsy needle, specifically between 0.5 and 0.7 millimeters, the hair grafts we harvest will contain 1, 2, or at most 3 hair strands. Therefore, we will obtain very natural results in the transplants performed with these grafts, leading to a successful outcome. Our patients frequently ask when the transplanted hair will start to grow. That is truly an excellent question. Naturally, as we are focused on success and results, I would like to explain this with emphasis. Our new hair starts to grow from the 2nd month after the transplanted hair. I want to explain this clearly without any confusion. New hair begins to grow from the 2nd month, and the growth period is on average 6 to 8 months, meaning it reaches its final state between 6 and 8 months post-transplant. A patient should be aware of this. Starting from the 2nd month, new hair will begin to grow. With each passing day, week, and month, the density of the hair will increase. And we will need an average time frame of 6 to 8 months for it to reach its final appearance. After all the transplanted hair has emerged, during the 1-year process following the transplant, these hairs will also get stronger, and we and our patients will witness this personally. In other words, these hairs grew between the 6th and 8th month and will continue to strengthen and thicken thereafter. What should we do after hair transplantation? Of course, specifically during the pre-transplant examination of our patients, we also visualize the treatments after the transplant, after the application. We have made this decision. We do not leave our patients to their fate after hair transplantation. We can call it a kind of doping. We can also call it a kind of support. Additional treatments are determined by the patient's pre-transplant examination findings. These involve many different alternatives, and we have a wide range of options available to us. We can use some lotions, sprays, we can use some medicines. Following the transplant, we can perform PRP mesotherapy or mesotherapy with various active ingredients. But the point I want to emphasize is this. Our patients will not be left to their own devices after the hair transplant surgery. They will not be left unsupported. Especially as Esteport Hair Transplant Center, Dr. Azali Mezdeği, we will personally administer our patients' treatments after the transplant procedure and conduct their follow-ups ourselves. Their happiness will be our happiness.